let's get started. Today is breathing exercises and a guided meditation for stress relief. I'd like to tell you a little bit about AMH, or Align Modern Health, before we go into the breathing exercises. Align Modern Health is an integrative medicine facility. And so what that means is that we integrate multiple perspectives of educated health professionals using evidence-informed modalities. So what we have is chiropractic and physical medicine, clinical massage, functional medicine, and clinical nutrition, as well as acupuncture. The chiropractic and physical medicine work very closely with the clinical massage to work on musculoskeletal issues. The functional medicine and clinical nutrition work on internal issues of the patient, and acupuncture and traditional Chinese herbalism is a great bridge between those, as acupuncture can work on musculoskeletal issues as well as internal issues like digestion or men and women's health and fertility. Integrative medicine is also looking at going at the root cause and treating the person as a whole. So a little bit about myself is I'm, as I said, Dr. Christina Slider. I am a licensed acupuncturist at Align Modern Health. I am NCAAOM certified in acupuncture and traditional Chinese herbal medicine. I have my doctorate and master's in traditional Chinese medicine from Pacific College of Health and Science. There are 3 campuses of that wonderful school, and I attended the one in Chicago downtown. Before coming to Chicago, I got my bachelor's in fine arts at College of Santa Fe, which was one of the first places that I got most interested in the mind-body connection, as we were learning method acting practices, which is all about using your mind to affect your body and affect your emotions. Once I came to Chicago in 2011, shortly after, I got my massage therapy certificate from Fortiva, and I practiced as a licensed massage therapist for 2.5 years before entering acupuncture school. I was always working with chiropractors because I wanted to be working in a clinical situation. My clinical passions include creating a no-shame environment for every patient so that I can empower patients to love their bodies as we work on things like sleep disorder or mood regulation. So I'd like to tell you a little bit about our nervous system before we get into these breathing exercises so that we know what we're trying to do with them. So 2 sides of the nervous system that we're going to focus on today is the sympathetic nervous system and the parasympathetic nervous system. So for a long time, I mixed these up. I always was thinking that the sympathetic nervous system surely was rest and digest and calm and connect. It was sympathizing with us by giving us that. In grad school, I was talking to a fellow student, and she, with her infinite wisdom, was like, no, Christina, the sympathetic nervous system is fight or flight because we are perceiving that we are not safe. And the sympathetic nervous system is sympathizing with that, reacting, and changing the cascades of hormones in our body and what our circulatory system is doing so that we can become safe. So that being said, it's a survival mechanism that is reacting to situations that are perceived and then releases hormones so that our circulatory system contracts, and that creates a pounding or quickened heartbeat, tense muscles, sometimes sweating. Over time, if we're in a sympathetic dominance, for a long time. So we're perceiving that we're not safe for a long time. That causes a breakdown in our body. So one, it literally changes the integrity of our blood vessels, and that can lead to high blood pressure, artery clogging deposits. Just feeling off all the time will lead to anxiety and depression. And then those that are trying to self-medicate may find themselves struggling with addiction. So our parasympathetic nervous system is our rest and digest, our calm and connect. So it is the other side of the sympathetic nervous system. Once the sympathetic nervous system has aided our body to get to a place of safety, then our blood can go to different places in our body, help us be able to rest and digest and connect with those who are around us. So ways that we can help activate our parasympathetic nervous system is to eliminate alcohol and caffeine, sleep at least 7 hours a night, exercise, keep a journal, practice restorative yoga or Qigong. Qigong is a movement practice that connects us with our breath as well as the energetics of our body. Something that I like to tell some of my patients is to use a hot water bottle, put it under their low back, close to their spine for 20 minutes, and then to the other side of their spine for 20 minutes. And that helps a feedback loop that happens between the adrenals and the kidneys to help put us into parasympathetic nervous system dominance. At Align Modern Health, you can get acupuncture treatments or be supported by a provider and use supplements like ashwagandha. Today, we're going to practice breathing exercises and meditation. Chinese medicine and Chinese philosophy has a million beautiful metaphors that I fell in love with. As I started as an artist, there's a lot of artistry to traditional Chinese medicine. And so one of the basic foundational ideas is yin and yang. So we can see how that parasympathetic nervous system and that sympathetic nervous system are kind of two sides of the same coin. We need to be able to rest and digest to get the nutrients necessary to be able to run away from a threat. And we also need to be able to run away from a threat so that we have time to rest and digest. It's the same with yin and yang. But we want to find a balance where those two are engendering each other and they're not overwhelming each other. So yang activities we think of as like multitasking, studying, taking care actively of people. Yin activities more like relaxing, deep breathing, sleeping. And I think it's pretty clear that it's kind of like the sun can only rise once it has set. It's the same thing with yin and yang. Yin grounds our yang, and yang creates our yin. Let's get into these breathing exercises. And before we do, we need to get the foundation of how to breathe in a way that activates our parasympathetic nervous system. So diaphragmatic breathing or belly breathing is a beautiful activity that massages our organs and activates our vagus nerve, which helps puts us into parasympathetic dominance. So what I'll have you do is lie on a flat surface, the floor, your bed, or sit comfortably upright in your chair. If laying down, gently bend your knees with your feet planted on the ground or bed. If sitting up, plant your feet on the floor with your knees bent at a soft 90-degree angle, and place one hand flat on your upper chest and the other on your belly just below your ribs. Now close your eyes and breathe in slowly through your nose. Allow the belly to push outwards and envision the belly being filled up like a balloon. Now exhale through your mouth, tightening the abdominal muscles and releasing the belly back to its normal resting position. Let's do that again. Breathe deeply in through your nose, filling up your abdomen, even letting that extend to your low back. And then exhale through your mouth, tightening the abdominal muscles and releasing the belly back to its normal resting position. And when you practice this on your own, remember that your hand on your chest should remain still, as only the belly, not the chest, should rise and fall, so that we get that diaphragmatic movement, massaging our organs, massaging that vagus nerve. We will move on to our first exercise. So I'm going to go through how to do the exercise, then we're going to practice it together, and then finally we're going to find out a little more details about this exercise. So first is 3 deep breaths. So how you'll do that is we'll inhale deeply through the nose for 3 counts. Exhale evenly through the mouth for 3 counts, and then repeat 3 times. So let's do this together. Inhale deeply through the nose for 3 counts. 2, 3. Exhale evenly through the mouth for 3 counts. 2, 3. Again, deeply through the nose. 2, 3. Exhale evenly through the mouth. 2, 3. One more time, deeply in through the nose. 2, 3. Evenly through the mouth. Exhale. 2, 3. All right, awesome. We're becoming pros already. So a little more advanced knowledge about where 3 deep breaths came from. Thomas Crum wrote a book called 3 Deep Breaths, Finding the Power and Purpose in a Stressed Out World. And he proposed the idea that with each round of these deep breaths, we focus on a calming element, kind of a manifesting technique. And so I would like to tell you that with breathing exercises, it'll be great to practice them when you're already in a parasympathetic dominance place when you first start, so that they're more accessible when you become in a sympathetic dominant state. That being said, I want to tell you a little bit about these manifesting rounds. So your first round would be your centering breath, and that is where you focus solely on the breath itself and the physical body becoming more aligned and rooted to the earth, with gravity flowing through you, leaving you both feeling grounded and weightless at the same time. Lovely. The second breath is the possibility breath. Now allow your mind to wander to thoughts of you being the best you, having phrases like I am capable, I am nurturing, I am able to achieve great things. And then the third breath is he calls the discovery breath. And that is where you focus on releasing all the judgments that constrain your choices and cause you to be reactive to others. So it allows you to see the bigger picture unfold and breathe in the true mysteries and magic of life itself. So that's our first. Now we have a second breathing exercise, and that's called box breathing. So again, I'll tell you how we do it, and then we'll practice it together. So with box breathing, you will inhale deeply through your nose for 4 counts, hold for 4 counts, and then exhale through your mouth for 4 counts, hold for 4 counts. And it makes a box, as you can see on the screen. And we will repeat that 4 times. If you're a visualizer, you can close your eyes and visualize the box in your mind. If you're not, use our lovely picture here. So let's plant our feet on the ground, whether you're laying or sitting. Bend your knees so you can plant your feet firmly on the ground. Place one hand on your chest, the other on your belly. And now take a deep breath in through your nose. 2, 3, 4. Hold. 2, 3, 4. Exhale through the mouth. 2, 3, 4. Hold. 2, 3, 4. Again, inhale through the nose. 2, 3, 4. Hold. 2, 3, 4. Exhale through the mouth. 3, 4. Hold. 2, 3, 4. Again, inhale through the nose. 2, 3, 4. Hold. 2, 3, 4. Exhale through the mouth. 3, 4. Hold. 2, 3, 4. One more time. Inhale through the nose. 2, 3, 4. Hold. 2, 3, 4. Exhale through the mouth. 3, 4. Hold. 2, 3, 4. And our next exercise, you all did amazing, I'm sure. So our next breathing exercise is called 4-7-8 breathing. 4-7-8 breathing is where you inhale deeply through your nose for a count of 4. Hold the breath deep in your diaphragm for a count of 7. Then exhale slowly through your mouth for a count of 8. And so we're going to do this together once. All right, plant those feet, place those hands, and follow along with me. Inhale deeply through the nose. 2, 3, 4. Hold deep in the diaphragm. 3, 4, 5, 6, 7. Exhale slowly and evenly through the mouth. 3, 4, 5, 6, 7, 8. Awesome. So this is a more advanced breathing exercise. And so there are a little, just like in yoga, when you're trying to get into a position that is more difficult, there are some ways to modify it. So we want to, if we find it a little bit difficult, make a goal of, okay, I'm going to practice this for a month. I'm going to start by lowering the counts, but keeping the ratio. So you can start with a 2, 5, 6. So you'll inhale for 2, hold for 5, and then exhale for 6. And then you'll practice that. Try to make it at least once daily. Then once that gets comfortable, you move up to 3, 6, 7, and eventually get to that 4, 7, 8. Now, lightheadedness is normal when we are practicing deep breathing. A lot of oxygen is getting to parts of our body that perhaps we're not. And so I just want you to remember to remain calm. And if the lightheadedness doesn't go away and it persists, then just return to your normal breathing pattern. You have all the power here. And ideally, you want to quietly inhale through your nose with this exercise and audibly exhale through your mouth. And even when you become a pro, then you can start placing the tongue gently on the tissue behind your upper teeth. All right, and now that we are breathing experts, I'd like to guide you on a simple meditation. The meditation is called Love and Kindness, and it is my very favorite meditation. It has a mantra within it where we send love and kindness to ourselves. And I often will coach my patients on going through that mantra while they're on the table. And so it starts with progressive relaxation, then we go into using the mantra, and then we do a little bit of visualization as well. If you're not a visualizer, I welcome you to just bring into mind, at one point, we'll visualize ourselves. And if you can't bring up a picture of yourself, either I would encourage you to simply have that knowing that you are here, you are sending love and kindness to yourself. So let's plant our feet. And I actually would welcome you to place your hands in your lap with palms up. Connect with the weight of your body, the contact points of your body on your seat or on the floor. Bring your awareness to the now, temporarily letting go of all past and future, and let yourself be content. Take a deep breath in through your nose and exhale through your mouth. Now bring your awareness to the top of your head. Softly let that awareness melt down to your forehead, relaxing your forehead till you get to your eyebrows, at which point I encourage you to scrunch up your eyebrows and then release. And then match that with a deep breath. So inhale and scrunch up your eyebrows. Exhale and connect with the release of the exhale. Let that release flow down your cheeks to your mouth. Let your teeth separate while your lips stay connected. Deep breath in. And then feel the release of the exhale and bring a gentle smile to your face. Connect with the joy of that gentle smile. Now we can go to the back of the head, focusing on the exhale as we feel the relaxing, dropping down the back of our head, down our neck, to our shoulders. When we get to our shoulders, I want us to inhale and lift our shoulders up to our ears. And on that exhale, let them drop. One more time, inhale, lifting the shoulders up. Exhale, let them drop. We'll flow down to our abdomen, noticing the filling of our abdomen on the inhale, and then the contracting on the exhale. Now I want you to bring to your mind a picture of yourself. It can be as you are now or when you were a child. Simply bring the knowing that you are with yourself and you are sending this to yourself. And repeat after me. I am safe. I am healthy. I am happy. I and at peace. Deep breath in and out. Notice the sinking that happens with the exhale. I want that love that you connected to with the mantra to take the form of a bright, warm light at your heart. Know that you have a bright, warm light in your heart. And as you take deep breaths in, let that exhale release the tension in your body. Feel that bright, warm light expanding and extending out to all inches of your body. Deep breath in, exhale out. And knowing we are filled with warm, bright light, I would like us to send love and kindness again to ourselves. I am safe. I am healthy. I am happy. I am at peace. I am safe. I am healthy. I am happy. I am at peace. Now, I welcome you to bring your hands together. Start to move those palms, rubbing those palms together until you start to feel some heat. Once you have the heat created by your palms, place your palms on your eyes and do circular motions, just warming up those eyes before we come back. You can let those warm palms wake up your cheeks. Use your fingertips to wake up the top of your head, down the back of your head, down your neck, into your shoulders. Deep breath in and let your hands fall back into your lap on the exhale. It's always good to do a little self-massage after doing a meditation, just so that we can have a easing back into this more conscious productivity world. And what I love about love and kindness is as we learn to send that to ourselves, we can use it to send to loved ones. And the most advanced stage would be to do this and send it to difficult people in your life, which sometimes sounds counterintuitive, but I can tell you it will bring you so much joy if you are able to get to that place where you can send love and kindness to even the people that irritate you. So thank you so much. If you do have any questions, please put them in the Q&A feature now on Zoom. And then you can also fill out, you can also schedule a free 15-minute consult. And that is a great place to get any questions answered as well. But I will look at the Q&A feature and see what kind of questions you may have. We also, I do want to say, we are in network with different insurances, as you see on the slide here. Let's see what's happening with these questions. So how often do you recommend doing these exercises? I recommend doing them daily. I would recommend doing them to start off, being kind to yourself and being like, okay, I'm feeling good right now. I'm going to practice my breathing exercises. Start with the simplest one, that 3-breath one. And then once you are in a pattern, like for a week of doing it daily in a comfortable place when you're not already high stress, then I welcome you to start doing it twice a day. So you're going to do it once when you're feeling calm, and then another time when you're starting to notice that your shoulders maybe are up to your ears. And so that's a great question. Somebody asked, and it was what I thought, was what if I'm not healthy or happy or peaceful? And I love this question because you can change it from I am happy to may I be safe, may I be healthy, may I be happy, may I be at peace. But I would also urge you to challenge your self-perception. And even though you may not feel peaceful or healthy right now, and objectively, we are all going through things, it is good to give your system that message, no matter what state you're in. Thank you for that question. I have somebody who's asking specifically about ashwagandha. And what I would say there is that we do not sell it in-house here. But my main point about it will be that it is an Ayurvedic herb. And so that is a system of medicine that comes from India. When you are prescribed supplements, we have something called full scripts, so we can have supplements sent out to you. But most importantly, we are usually advising you to take these supplements based off of labs or evaluations that we have done. And so ashwagandha may be the right formula or herb for you. It may not. It's necessary to be evaluated by a provider because there are a couple of like interactions that ashwagandha can have with other things you may be taking. Thank you for asking whether there are acupuncture treatments that can bring these feelings of calm. And I would say definitely. There is something that people fondly call like acu-high, which is essentially this feeling of lightness after an acupuncture treatment that can happen immediately and will last throughout the day often, or at least a couple hours. And to me, that is it seems like a small thing, perhaps, but to have that moment of calm, especially like with the woman who spoke about not feeling peaceful right now, to be able to connect in with that feeling, even for a few hours, can create what's called like a sense memory. And once we have that sense memory, we can connect back to that, which is very, very special for those who perhaps have gone through any kind of chronic trauma and have a hard time connecting or remembering a time that they felt calm and peaceful. All righty. Um, yeah, so it looks like that's most of the questions. They've been answered. I will also say that I'm kind of sneaking, looking at a couple other things. Uh, that Insight Timer is a meditation app um, that I like. And my teacher is on there, Guogu, which is Guogu. And he has 11 Kindness on there. Um, Tallahassee Chan Center on YouTube as well is a great place. And then, ooh, um, I see. So the best exercises to stimulate the vagus nerve, I really would say is to start it with belly breathing. Even if it's you don't do any of the counting or anything, just connect it, putting your hand on your abdomen and the other hand on your chest and making sure that your breathing is expanding the belly and not the chest is a beautiful way to activate the vagus nerve because you're using your body to massage your vagus nerve and your internal organs, and that focusing on the exhalation is a beautiful thing that my teacher always talks about. And as somebody who had been practicing different breathing for a long time, I was moved by how much just focusing on my exhalations could give me a feeling of peace. Also, with acupuncture, we do auricular needling, which is in the ear. And that is a great place to access the vagus nerve as well, as it has branches that come out into the ear. You could try massaging your ears as well. Um, Everybody, I'm so happy that people are getting a lot out of these breathing exercises and it's helping with your stressful week.
Dr. Slider, I think that brings us to all the time we have for today. So there are any last comments you'd like to make or thank yous you'd like to send? And then I think we can wrap it up for today.
Yeah, I would just like to thank everyone that attended today. And I love there was a comment about like community healing sessions. And I do think it was very, very powerful for us all to practice this together. So I thank you for showing up and practicing with me today.